Go look in a mirror right now. Look closely at your eyes. If you are over 60 and you see any yellowing, a gray or white ring around the colored part, redness that will not go away, or tiny blood spots, doctors are warning that your eyes may be revealing a serious disease hiding inside your body that has nothing to do with your vision. And most seniors walk right past the mirror every morning without ever noticing these changes. Your eyes are not just organs that help you see. They are windows into the health of your entire body, and doctors say they can reveal problems in your heart, your liver, your brain, your blood vessels, and even your risk of stroke and diabetes, often long before any other symptoms appear. The blood vessels in your eyes are the only blood vessels in the entire human body that doctors can observe directly without surgery. This makes your eyes one of the most powerful diagnostic tools in medicine, and yet most seniors never think to look. Here is what I see in my practice almost every week. A patient comes in for a routine visit, and during the examination, I notice something in their eyes that they had no idea was there. A subtle yellowing of the whites, a faint ring around the iris, a cluster of tiny red dots that appeared without explanation. And when we run tests based on what the eyes revealed, we discover an underlying condition that the patient did not know they had. Sometimes it is high cholesterol. Sometimes it is liver dysfunction. Sometimes it is the early signs of diabetes or cardiovascular disease. Their eyes told us the story before their body showed any other sign. My name is Dr. Michael Williams, and I want every senior watching this video to understand something important. Your eyes can tell you and your doctor things about your health that no other part of your body can. The changes I am about to describe are subtle, but they are significant, and recognizing them could give you the early warning you need to prevent a serious health crisis. In this video, I am going to reveal the 8 eye changes that doctors say seniors should never ignore. I am going to explain what each one could mean about what is happening inside your body. And I'm going to tell you exactly which ones require urgent medical attention and which ones you should discuss with your doctor at your next visit. The 5th change on this list is one that millions of seniors notice and dismiss as nothing, but cardiologists say it could be one of the earliest visible signs of cardiovascular disease. So please watch this entire video because your eyes may be trying to save your life. Let us start with the first eye change, and it is one that most people associate with liver problems, and they are right to be concerned. It is yellowing of the whites of your eyes. The white part of your eye, called the sclera, should be exactly that, white. When the sclera takes on a yellowish tint, a condition called jaundice, it is almost always a sign that something is going on with your liver or your bile ducts. Jaundice occurs when bilirubin, a yellow pigment produced when your body breaks down old red blood cells, builds up in your blood instead of being properly processed by the liver. In seniors over 60, yellowing of the eyes can indicate several conditions. It could be a sign of liver disease, including hepatitis, cirrhosis, or fatty liver disease. It could indicate a gallstone blocking a bile duct. In more serious cases, it can be associated with pancreatic cancer or bile duct cancer, both of which can obstruct the flow of bile and cause bilirubin to accumulate. Even certain medications can stress the liver enough to cause mild jaundice. If you notice any yellowing of your eyes, even if it is subtle, this is a symptom that warrants prompt medical evaluation. A simple blood test can measure your bilirubin levels and liver enzyme levels, and imaging can identify any structural problems. Do not wait for the yellow to become obvious. Even a faint tint deserves attention. The second eye change is something that many seniors over 60 notice but rarely mention to their doctor. It is a gray or white ring that appears around the outer edge of the colored part of your eye, the iris. Doctors call this arcus senilis, and it is caused by cholesterol and other lipid deposits accumulating in the cornea, the clear front surface of your eye. In people over 60, arcus senilis is relatively common and is not always a cause for concern. But doctors say the context matters enormously. If the ring appears before the age of 60, it is strongly associated with elevated cholesterol levels and significantly increased cardiovascular risk. In people over 60, a newly appearing or rapidly progressing arcus can still be a signal that cholesterol levels are higher than they should be. Research has shown that the presence of arcus senilis is associated with a higher risk of heart disease. and some studies have found that people with a prominent ring are more likely to have atherosclerosis, which is the dangerous plaque buildup in the arteries. If you notice a white or gray ring around your iris, do not panic, but do mention it to your doctor and request a lipid panel to check your cholesterol levels. It is a simple blood test that could reveal a hidden risk factor you did not know you had. But the third eye change is one that should never be ignored, because it can appear suddenly and signal an imminent threat. It is a sudden loss of vision or a dark shadow in one eye. If you suddenly lose vision in one eye, experience a dark curtain or shadow falling across part of your visual field, or see a burst of new floaters accompanied by flashes of light, this is a medical emergency. These symptoms can indicate a retinal detachment, where the retina at the back of your eye separates from its underlying tissue, or a retinal artery occlusion, which is essentially a stroke in the eye. A retinal artery occlusion is caused by a blood clot blocking the artery that supplies blood to the retina, and it is treated as a stroke equivalent because the same kind of clot that blocks a retinal artery can also block an artery in the brain. If you experience sudden vision loss or a shadow in your vision, call emergency services or go to an emergency room immediately. Time is critical. In the case of retinal detachment, surgery within hours can often save your vision. In the case of a retinal artery occlusion, the clot itself and the underlying cardiovascular condition that caused it need urgent evaluation and treatment to prevent a full stroke. The fourth eye change is one that develops gradually and is easy to dismiss as simply part of aging. It is persistent redness in one or both eyes. Now, occasional redness from irritation, allergies, or dryness is common and usually harmless. But persistent redness that does not respond to over-the-counter eye drops and lasts for weeks or longer can be a sign of underlying inflammation, either in the eye itself or systemically throughout the body. In seniors, chronic eye redness can be associated with autoimmune conditions like rheumatoid arthritis, lupus, or sarcoidosis. It can indicate uveitis, an inflammation of the middle layer of the eye that can lead to permanent vision loss if untreated. And in some cases, persistent redness is associated with uncontrolled diabetes or high blood pressure, both of which cause damage to the tiny blood vessels throughout the body, including those in the eyes. If you have redness that persists for more than 2 weeks and does not respond to basic treatments, please see an eye doctor for a thorough evaluation. Identifying the underlying cause early can protect both your vision and your overall health. And now we come to the fifth eye change, the one I mentioned earlier that cardiologists say is an early visible sign of cardiovascular disease. It is visible blood vessel changes on the surface of or inside the eye. During a routine eye exam, your ophthalmologist or optometrist can look directly at the blood vessels in the back of your eye using a tool called an ophthalmoscope. What they see there is remarkably revealing. Narrowed arteries in the retina mirror the narrowing that is occurring in arteries throughout your body. Thickened artery walls in the eye suggest hypertension-related damage that is also affecting your heart and brain. And areas where arteries cross over and compress veins, called AV nicking, are a telltale sign of long-standing high blood pressure. Even without a clinical exam, some vascular changes are visible to the naked eye. Small red spots on the white of your eye, called subconjunctival hemorrhages, are caused by burst blood vessels and can sometimes be triggered by blood pressure spikes or blood-thinning medications. While a single occurrence is usually harmless, frequent or recurring episodes deserve investigation. This is one of the most powerful reasons to have regular eye exams after 60, and I mean comprehensive dilated eye exams, not just a quick vision check for glasses. The information your eye doctor gathers about the health of the blood vessels in your eyes can reveal hypertension, diabetes, high cholesterol, and cardiovascular risk that may not yet be causing any other symptoms. Many doctors now consider a comprehensive eye exam to be as important as a blood test when it comes to assessing cardiovascular health in seniors. The sixth eye change is one that is particularly common in seniors with diabetes, and it is critically important to catch early. It is dark spots, blurred patches, or floating shapes in your vision. These can be signs of diabetic retinopathy, a condition where high blood sugar levels damage the tiny blood vessels in the retina. In the early stages, diabetic retinopathy may cause no symptoms at all, but as it progresses, damaged blood vessels can leak fluid, swell, or form scar tissue. leading to blurred vision, dark spots, and eventually blindness if left untreated. Diabetic retinopathy is the leading cause of blindness in adults, and it is almost entirely preventable with early detection and proper blood sugar management. If you have diabetes, even if it is well controlled, you should have a dilated eye exam at least once a year. If you do not have diabetes but notice any of these visual changes, it is worth being screened for blood sugar issues, as diabetic retinopathy can sometimes be the first sign that a person has developed diabetes. The seventh eye change is one that many seniors notice and brush off as cosmetic. It is drooping of one eyelid that was not there before. Unilateral ptosis, or drooping of one eyelid, can have several causes. In some cases, it is simply age-related weakening of the muscle that lifts the eyelid. But in other cases, particularly when the drooping appears suddenly or is accompanied by other symptoms, it can be a sign of something more serious. A sudden drooping eyelid can indicate nerve damage from a condition called Horner syndrome, which can be associated with lung cancer, stroke, or damage to the carotid artery. It can also be an early sign of myasthenia gravis, an autoimmune condition that causes progressive muscle weakness. And in rare but critical cases, sudden eyelid drooping with a dilated pupil and eye pain can indicate a brain aneurysm that requires emergency intervention. If you notice new drooping of one eyelid, especially if it appeared suddenly or is accompanied by double vision, headache, eye pain, or a change in pupil size, seek medical attention promptly. Even if the cause turns out to be benign, it is worth having checked. The eighth and final eye change is one that connects directly to your overall health in a way that might surprise you. It is increasingly dry, irritated eyes that do not respond to artificial tears. While dry eye syndrome is common in seniors and often has simple causes like reduced tear production or environmental factors, persistent severe dry eye can sometimes be associated with autoimmune conditions like Sjögren syndrome. Sjögren syndrome causes the immune system to attack the glands that produce moisture, affecting not only the eyes but also the mouth, and it is associated with increased risk of lymphoma and other systemic complications. Severe dry eye can also be a side effect of multiple medications that seniors commonly take, including antihistamines, blood pressure medications, antidepressants, and hormone therapies. If your dry eye is severe enough to interfere with daily activities and does not respond to over-the-counter treatments, a thorough evaluation can identify whether it is a standalone condition or a symptom of something more significant. Now, I want to pull all of this together and leave you with some practical takeaways. Your eyes are incredible diagnostic tools, and paying attention to them can reveal health problems that might otherwise go undetected for months or years. Here's what I recommend. First, perform a simple eye self-check at least once a month. Look at yourself in a mirror in good lighting and examine the whites of your eyes for yellowing, redness, or spots. Check for any gray or white rings around your iris. Notice whether your eyelids are symmetrical, and pay attention to any changes in your vision, including new floaters, flashes, shadows, or blurriness. Second, schedule a comprehensive dilated eye exam at least once a year. This is different from a simple vision screening. A dilated exam allows your eye doctor to see the blood vessels, the retina, and the internal structures of your eye in detail, revealing information about your cardiovascular health, your blood sugar, your blood pressure, and your neurological function. Third, report any sudden vision changes to your doctor immediately. Sudden loss of vision, sudden appearance of floaters or flashes, and sudden changes in eye appearance should be treated as urgent symptoms that require prompt evaluation. Let me recap the 8 eye changes we covered. First, yellowing of the whites of your eyes. Second, a gray or white ring around the iris. Third, sudden vision loss or shadows in your visual field. Fourth, persistent redness that will not go away. Fifth, visible blood vessel changes that mirror cardiovascular disease. Sixth, dark spots, blurred patches, or floating shapes from diabetic retinopathy. Seventh, new drooping of one eyelid. And eighth, severe persistent dry eye. Your eyes are trying to tell you something. Please take the time to listen. If this video was valuable to you, please subscribe to this channel. I create new content every week to help seniors understand their health from every angle. And if you know someone over 60 who has not had a comprehensive eye exam recently, please share this video as a reminder that their eyes might be revealing something their body has not told them yet. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Take care of your eyes and take care of yourselves.